Hi everyone, Vijay here, 21D. I've been asked to make a video explaining why we request photos when we're going through the initial triage. So when you fill in your form and you submit and you'd like us to consider you for our solution, there are certain steps that we go through. One of them is the coordinators will ask for photos that they actually share with clinicians in this company. And clinicians from the photos will make an outline call about whether this is the right treatment solution for you from the photos you provide. Now, obviously, we'd like x-rays as well, but a lot of you are telling us that you haven't got x-rays or can't get x-rays. If you could get x-rays, that would be incredibly useful, but we still need the photos. So the photos themselves are just simple selfies using your phone, one of your whole face, resting, another one, a big smile, that would be good. Bite, that would be good. And then one showing the inside of the mouth at the top and the bottom, just so we can count the number of teeth you've got left and look at their general positioning and look at how your bite goes together and try and make some early decisions as to whether our solution is the right solution for you. Now, about 30–40% of the people that reach out to us just from the photos don't need what we do. They could actually be solved with much simpler dentistry because there's no clinical justification at all to take all their teeth out and put implants in. This implant reconstruction thing should only be considered as a last resort. There are other people that reach out to us with these photos, and what they need is some very, very, very simple clinical dentistry, maybe with some veneers or some simple bonding, just to correct some simple alignment with orthodontics. And again, no clinical justification to remove the teeth. Our clinical assessment pathway, we offer the patient the opportunity to access it for free, but it costs us £800 a time. So we need to be very careful about how we use this very precious clinical resource, because it costs time and money to take all these data sets. And we're not a general screening service. We're not a general practice. We only do one thing, which is full mouth implant reconstruction. We're not a general practice. So please understand that when you are asked for clinical photos, if you would like to be considered for our services, we absolutely require them. It's not shared in the public arena. These photos go only to the clinicians that work here, who make a clinical judgment on whether it is warranted for you to have a clinical assessment with us. And remember, the clinical assessment with us will almost always involve taking a cone beam CT scan, which is radiation, and there has to be clinical justification to do it. We can't just take x-rays for people. Okay, the radiation dose is very low, but it's still radiation, and there needs to be clinical justification. And the first step on that journey is to get photos from you. So please, when you are asked, provide photos. Thank you.